It's quite a startling thought, isn't it? An organ inside you working tirelessly day and night could be quietly accumulating fat without you even realizing it. This is precisely what happens with fatty liver disease, a condition where excess fat builds up in your liver cells. Your liver is a remarkable powerhouse, responsible for over 500 vital functions, from filtering toxins out of your blood to helping digest your food. When it becomes fatty, its ability to perform these crucial jobs is compromised. Think of it like a finely tuned engine becoming clogged with sludge. Eventually, it just can't run as efficiently as it once did. It's a modern health concern that often creeps up on us completely unnoticed. The sheer scale of this problem is staggering and truly deserves our attention. Globally, it's estimated that around 1 in 4 adults are living with a form of fatty liver disease known as non-alcoholic fatty liver disease, or NAFLD for short. This makes it one of the most common liver conditions worldwide, affecting billions of people. The numbers are even more concerning in certain regions and among specific populations, particularly those with high rates of obesity and type 2 diabetes. This isn't some rare, obscure illness. It is a widespread epidemic that is quietly unfolding in communities all around the globe, from London to Sydney, affecting people from all walks of life. What makes fatty liver disease particularly tricky is its silent nature in the early stages. Most people who have it experience no symptoms at all, which is why it often goes undetected for years, even decades. You could be walking around with a significant amount of fat in your liver and feel perfectly fine. It's only when the condition progresses to a more serious stage, such as liver inflammation, steatohepatitis, or scarring, fibrosis, that symptoms like fatigue, abdominal discomfort, or unexplained weight loss might begin to appear. This lack of early warning signs underscores the importance of understanding the risks and being proactive about our health, rather than waiting for problems to announce themselves. This condition is broadly split into 2 main types, which helps us understand its origins. The first is alcoholic fatty liver disease, which, as the name suggests, is caused by drinking too much alcohol. The second, and increasingly more common type, is non-alcoholic fatty liver disease, or NAFLD. This is the type that is closely linked to our modern lifestyle, particularly our diet and weight. It is a clear signal from our bodies that our metabolic health is under strain. Understanding this distinction is the first step towards figuring out what is going on inside our bodies, and more importantly, what we can do about it to turn things around. So what exactly invites all this unwanted fat to take up residence in our liver? For non-alcoholic fatty liver disease, the primary culprits are deeply embedded in our modern way of life. A diet high in processed foods, sugary drinks, and unhealthy fats is a major contributor. When we consume more sugar and calories than our body can use for energy, the excess is converted into a type of fat called triglycerides. These triglycerides are then stored in liver cells, leading to the buildup that characterizes the disease. It's not just about the obvious culprits like cakes and biscuits. Hidden sugars in so-called healthy yogurts, sauces, and breakfast cereals can also play a significant role in this process. Weight is another crucial factor in this equation. Being overweight or obese dramatically increases your risk of developing NAFLD. In particular, carrying excess weight around your middle, often referred to as visceral fat, is strongly linked to the condition. This type of fat isn't just sitting there. It's metabolically active, releasing inflammatory substances that can contribute to liver damage and insulin resistance. When your body becomes resistant to insulin, your blood sugar levels rise, prompting your liver to produce even more fat. It becomes a vicious cycle that can be incredibly difficult to break without making significant lifestyle changes. Beyond diet and weight, there are other important risk factors to consider. Having type 2 diabetes puts you at a very high risk for developing NAFLD. In fact, the 2 conditions often go hand in hand. High cholesterol and high blood pressure, which are components of what doctors call metabolic syndrome, are also strongly associated with a fatty liver. These conditions are all interconnected, painting a picture of a body struggling to manage its metabolic processes effectively. It shows how one aspect of poor health can easily cascade, leading to a host of other related problems that affect our long-term well-being. For alcoholic fatty liver disease, the cause is much more straightforward: excessive alcohol consumption. Drinking more than the recommended limits puts a tremendous strain on the liver, as it is the primary organ responsible for breaking down alcohol. This process generates harmful byproducts that can damage liver cells, promote inflammation, and disrupt the liver's normal fat metabolism. Over time, this leads to a buildup of fat, which is the first stage of alcohol-related liver damage. For many, simply reducing or eliminating alcohol can halt or even reverse this process if it's caught early enough, highlighting the direct impact of our choices. Because fatty liver disease is so often silent, doctors rely on a series of clues and tests to uncover it. The process of diagnosis often begins incidentally, perhaps during a routine checkup or when investigating another health issue. A simple blood test, known as a liver function test, is usually the first step. This test measures the levels of certain enzymes in your blood, such as ALT and AST. If these enzyme levels are elevated, it can be a sign that your liver cells are irritated or damaged, which prompts your doctor to investigate further. It's a bit like a smoke alarm. It doesn't tell you the exact cause of the fire, but it signals that something is wrong. If the blood tests raise a red flag, the next step is often an imaging test to get a direct look at the liver. The most common and accessible of these is an ultrasound scan. This is a completely painless and non-invasive procedure that uses sound waves to create a picture of your organs. On an ultrasound, a fatty liver often appears brighter than a healthy liver, giving the doctor a strong visual confirmation of fat accumulation. It's a quick and effective way to see the extent of the fat buildup and rule out other potential liver problems, providing a crucial piece of the diagnostic puzzle for your medical team. In some cases, your doctor might want to assess whether there is any stiffness or scarring in the liver, as this indicates a more advanced stage of the disease. A special type of scan called a fibroscan, or transient elastography, can be used for this. Much like an ultrasound, it is quick and painless. The device sends a mechanical pulse through the skin to measure how fast it travels through the liver. The faster the pulse travels, the stiffer the liver is, suggesting the presence of fibrosis or scarring. This information is vital for determining the severity of the condition and guiding the appropriate course of action for treatment. For a definitive diagnosis and to understand the precise extent of inflammation and damage, a liver biopsy may be recommended, although this is less common. This involves taking a very small sample of liver tissue with a needle, which is then examined under a microscope. While it is the most accurate method for assessing the severity of liver disease, it is also an invasive procedure and is typically reserved for cases where there is diagnostic uncertainty or when confirming a more serious condition like non-alcoholic steatohepatitis or NASH. For most people, a combination of blood tests and imaging scans is sufficient to make an accurate diagnosis. The wonderful news about fatty liver disease, particularly NAFLD, is that it is largely reversible, especially in its early stages. There are no specific medications to treat it, which means the most powerful tools for recovery are in your own hands. The cornerstone of treatment is gradual and sustained weight loss. Losing just 5% of your body weight can start to reduce the fat in your liver. Aiming for a 7 to 10% reduction can significantly decrease liver inflammation and may even reverse some liver scarring. This isn't about crash dieting, but about making sustainable changes to your lifestyle that you can maintain for the long term. Improving your diet is absolutely fundamental to this process. A Mediterranean-style diet has shown fantastic results for liver health. This involves eating plenty of vegetables, fruits, whole grains, nuts, and healthy fats, like those found in olive oil and fish, while limiting red meat and dairy. Crucially, it means drastically cutting back on sugar and refined carbohydrates. Things like sugary drinks, sweets, white bread, and pasta are quickly converted to fat by the liver. Swapping these for whole, unprocessed foods gives your liver the break it needs to start healing and shedding the excess fat it has been storing away. Regular physical activity is the other key component of the recovery plan. Exercise helps your body use up glucose for energy, which improves insulin sensitivity and reduces the amount of fat being stored in the liver. A combination of aerobic exercise like brisk walking, cycling, or swimming, and some resistance training is ideal. The goal is to aim for at least 150 minutes of moderate intensity activity per week, but remember that any movement is better than none. Starting small and gradually increasing your activity level is a fantastic way to build a lasting habit that benefits not just your liver, but your entire body. Ultimately, taking care of your liver is one of the most important things you can do for your overall health. This incredible organ works tirelessly for you, and it's up to us to give it the support it needs to function well. By making positive changes to our diet, managing our weight, and staying active, we can prevent and even reverse fatty liver disease. It's a powerful reminder that our daily choices have a profound impact on our internal health. Taking proactive steps today is an investment in a healthier, more vibrant future, ensuring your body's powerhouse can keep running smoothly for years to come.